Hello, I'm Dr. Anthony Nuara, MD, PhD. I'm a board-certified dermatologist and a medical scientist. Together with my wife, I started Foundation Skincare several years ago with the goal of helping patients with kind of simplified and effective means to combat various cosmetic issues, including hair loss, something that many patients struggle with and a difficult thing for a lot of dermatologists to tackle. To understand hair loss, you have to understand the hair growth cycle. So the growth cycle varies a little bit, but generally it's 3 to 5 years long. It varies a little bit. Folks who can grow hair down to their ankles have a much longer growth cycle. Men generally have a shorter growth cycle than women, but on average it's 3 to 5 years. Generally, you'll grow about half an inch of hair per month. That rate changes a little bit from individual to individual, and it does slow as we get older. When we talk about hair growth, we want to look at the different phases of hair growth. I like to think of this as the iceberg, river, and waterfall. So the anagen phase, or the growing phase of the hair cycle, we think of as the iceberg. These are the hairs that are actively growing and occupying your scalp, and they're about 80 to 85% of your hairs at any given time. Now, as those hairs reach the end of that 3 to 5 year growth cycle, they're going to enter what we call the catagen phase. The catagen phase is where you can think of that iceberg starting to melt, and it's actually transitioning now into a river. This is the transition phase where the hair growth slows, the follicles start to shrink, and those cells will now enter a dormant phase. And that dormant phase we call telogen. Telogen is this resting phase where the hairs are still kind of firmly attached to the scalp, but they're in a resting phase getting ready to transition to restart their growth cycle. At any given time, this is about 10 to 15% of your hair, and this represents kind of that calm transitioning river. Now, for the hair to go back to its growth cycle, back to anagen, we have to actually have the hair go through a shedding phase called exogen. And exogen is the waterfall. So that river now has to flow down. The hairs have to fall out. And now the water cycle can start again, or the hair cycle can start again. And those hairs will rejoin the growing population and go back into their anagen cycle. Now that we understand hair growth cycle, we have a little better understanding of hair loss cycle. There are many types of hair loss that dermatologists deal with. We generally separate those into scarring hair losses and non-scarring hair losses. The scarring hair losses are much more complex and really must be managed by a board-certified dermatologist to save you from losing more hair. Now, the non-scarring hair losses are thankfully more common, and we can generally separate those into the two most common types. Those are known as androgenic alopecia and telogen effluvium. Androgenic alopecia, sometimes called androgenetic alopecia, is related to genetics and hormones. You can think of this as the typical male pattern baldness related to testosterone levels, or typically DHT levels, that occurs in men as we get older, but it also strikes women, and women will have thinning of their hair in a non-scarring pattern that will typically spare the very frontal margin of their hairline, but will proceed back and thin across the crown. Now, telogen effluvium is what I like to call the shock and awe hair loss. Something happened to your body, a major stressor or a traumatic event or a surgery, a car wreck, childbirth. The reasons are varied, but something caused a large portion of your hair to stop growing and enter the resting phase early. And that can cause a tremendous amount of shedding. And we're going to kind of talk about that in terms of that waterfall model. So in androgenic alopecia, you can think of your iceberg model as the iceberg is now shrinking. We call this miniaturization. We're getting hairs remaining in the growth cycle for less time, and they just have less hair overall in the growth cycle. So some of those hair follicles do go dormant into a sleep. So this is like the global warming of hair loss, and this is known as androgenic alopecia. Now, telogen effluvium, this is really where a large portion of your hair goes down the river all at once. So a lot of hairs are forced into that catagen event all at one time. Again, whether it be an emotionally traumatic event, surgery, anesthesia, a car wreck, an illness such as COVID or the flu, these are all common events. And they cause a large chunk of that iceberg to break off and melt and float down the river all at once. And those hairs enter into that telogen phase in a synchronous manner. And so about 90 days later, they're going to fall off the waterfall altogether, and you're going to have this huge flood all coming out at once. And this big kind of shedding event we call telogen effluvium, and that can cause you to lose 25 to 50% of your hair all at once. Now, the good news is that those hairs have already committed to falling out, and they do tend to go back to that growth phase, to the anagen phase, and will grow again. And we generally tell patients that with good support, including nutritional support, it takes anywhere from 6 to 12 months for someone to recover from telogen effluvium. I hope you guys have enjoyed this infographic and this kind of analogy I use with my patients to better understand or better conceptualize the hair growth cycle and how it plays into hair loss and the different types of common hair loss.